My name's Bhardwaj Pindiprolu. I go by Bar. I am an interventional radiologist and a diagnostic radiologist, sort of 50-50 practice at Humber. I just started in August of 2024, so I am a few months into my practice. Really depends on what block I'm on. So if I'm doing diagnostics, then I'm interpreting CTs, ultrasound, X-rays, and MRI for inpatients and outpatients. The days that I'm on interventional, it gets, there's 2 IRs on every day at Humber. The IR on angio 1 and angio 2 kind of blocks. So that ranges from vascular procedures like a fibroid embolization to a non-vascular procedure. For example, today in the morning I started with a renal RFA, which is a radiofrequency ablation, where I put in a probe into the kidney, and we are essentially ablating or burning the tumor. So a minimally invasive way of treating cancer. A lot of different mentors in my learning career that kind of pushed me into interventional radiology. Started off, from a personal kind of connection with my father, who was addicted to nicotine, and I kind of helped him quit smoking. That kind of pushed me into medicine. Then did undergrad in sciences, and then went out to the West Coast in BC to do medicine. A few mentors there that pushed me into diagnostic radiology, which I did in Hamilton, Ontario. And then a few mentors during residency that pushed me into interventional radiology, which I did in Halifax in last year. Really the cases and helping the patients is probably the most satisfying. The team that I work with is really nice, and I love working with them. Every day's, I'm working with different people in different rooms, and that's a lot of fun. To give you kind of examples, I was on call this past weekend, and we had a bunch of satisfying cases. An embolization for an inferior mesenteric artery bleed. That patient's now discharged and he's doing well. So, just kind of cases and really the patients that kind of keep me going. Humber, really just because of the innovation that kind of goes on here. That's part A, the amount of growth that we're seeing in the GTA with interventional radiology and just diagnostic radiology, with volumes kind of going up. And Humber is sort of at the forefront of that. And the other reason is family. I grew up in the GTA and I have a lot of family nearby, so 2 big reasons. Yeah, I think I sort of touched on this in the last question. The biggest sort of excitement I have is the amount of growth that we're seeing. For example, like I've done a bunch of cryoablation cases, PE thrombectomy, where I trained in Halifax, and I'm excited to kind of bring that over into Humber, which we don't quite do yet here. So just the potential and room for growth, the reception that I'm getting from all the staff persons here is what excites me. Yeah. I actually just recently presented at the CIRSE conference, which is an interventional radiology conference in Europe, and that was on hepatic complete venous deprivation, so like portal and hepatic vein embolization for patients to increase their FLR growth so they don't go into liver failure. My kind of area of interest is venous work, and so I'm excited to kind of work with some of the other IRs here to get that going. Outside of medicine, I enjoy playing a lot of sports. I play a lot of tennis and racket sports, which I've been doing since elementary school. Basketball, I paint and do digital illustration. So all my research, I do my own artwork. So I enjoy doing that during my spare time. And with the, with winter coming up, I'm excited to get my skis out.